Welcome to my channel Medicine Guide. Fluocinolone, hydroquinone, and tretinoin topical cream is a combination of medicines used to treat moderate to severe melasma, skin discoloration, of the face. Melasma usually happens with hormone changes in women. In this video, we will discuss how this cream treat melasma, its proper use, dosing precautions of this cream. So let's start. But before that, please subscribe to my channel Medicine Guide. Now first we discuss, what is melasma? Melasma is a common skin disorder. Loosely translated, the word means black spot. If you have melasma, you're probably experiencing light brown, dark brown, and/or blue-gray patches on your skin. They can appear as flat patches or freckle-like spots. Commonly affected areas include your face, including the cheeks, upper lip, and forehead, as well as the forearms. Melasma is sometimes called the mask of pregnancy because it frequently affects pregnant women. Melasma typically darkens and lightens over time, often getting worse in the summer and better in the winter. Now we discuss the ingredients of this cream individually. Fluocinolone, a corticosteroid that reduces inflammation and itching, and constricts swollen blood vessels. It may also block melanin production. Hydroquinone, a skin bleaching agent that reduces the amount of melanin in the skin. It works by interfering with the metabolic processes in melanocytes, the cells that produce melanin. Tretinoin, a vitamin A derivative that helps the skin shed dead skin cells and increases skin cell turnover. It may also protect hydroquinone from breaking down and help it penetrate the skin. Tri-luma is a brand name for a cream that contains these three ingredients. It should be used exactly as directed by the doctor, and is not for long-term use. Tri-luma, fluocinolone acetonide, hydroquinone, tretinoin, cream 0.01%/4%/0.05% is the only FDA-approved topical treatment available to help reduce the appearance of dark spots associated with moderate to severe facial melasma. Tri-luma cream is the only approved prescription, fixed-dose combination for facial melasma. Proper use. It is very important that you use this medicine exactly as directed by your doctor. Do not use more of it, do not use it more often, and do not use it for a longer time than your doctor ordered. To do so may cause unwanted side effects like skin irritation. This medicine is not for long-term use. This medicine is only for use on the skin. Do not get it in your eyes, nose, or mouth. Do not use it on skin areas that have cuts, scrapes, or burns. If it does get on these areas, rinse it off right away with water. This medicine should only be used for the skin condition that your doctor is treating. Before use, wash your hands with soap and water before and after using this medicine. Wash your face and neck with water and a mild soap. Rinse well and pat dry. Apply a small amount of the medicine to each affected area of the skin and include about half an inch of normal appearing skin around each lesion. Gently rub it in. Do not cover the treated area with a bandage unless you are told to do so by your doctor. Use a sunscreen with a sun protection factor of SPF 30 or higher during the day. Wear protective clothing, such as a hat, when you are outdoors. Moisturizers and cosmetics may be used during the day. Dosing. The dose of this medicine will be different for different patients. Follow your doctor's orders or the directions on the label. Further, only average dose of this medicine is discussed here. If your dose is different, do not change it unless your doctor tells you to do so. The amount of medicine that you take depends on the strength of the medicine. Also, the number of doses you take each day, the time allowed between doses, and the length of time you take the medicine depend on the medical problem for which you are using the medicine. For melasma, adults, apply a thin layer to the affected areas of the skin at least 30 minutes before bedtime. Storage. Store in the refrigerator. Do not freeze. Keep out of the reach of children. Do not keep outdated medicine or medicine no longer needed. Ask your healthcare professional how you should dispose of any medicine you do not use. Precautions. It is very important that your doctor check your progress at regular visits. This will allow your doctor to see if the medicine is working properly and to decide if you should continue to use it. Make sure your doctor knows if you are pregnant or planning to become pregnant. If you become pregnant while using this medicine, tell your doctor right away. This medicine may cause a skin condition called exogenous ochronosis, which is a blue-black discoloration of the skin. Check with your doctor right away if you have a gradual darkening of the skin. This medicine may make your skin more sensitive to sunlight, wind, and cold weather. Avoid sun lamps and tanning beds. Skin reactions such as dryness, redness, peeling, burning, or itching can occur when you use this medicine. Use a moisturizer as needed to lessen these skin problems. Using too much of this medicine or using it for a long time may increase your risk of having adrenal gland problems. Talk to your doctor right away if you have more than one of these symptoms while you are using this medicine: blurred vision, dizziness or fainting, a fast, irregular, or pounding heartbeat, increased thirst or urination, irritability, or unusual tiredness or weakness. If you have a sunburn, stop using this medicine until your skin is healed. Do not use any other medicines on the treated skin areas without talking to your doctor. Avoid using any skin care products that can dry or irritate your skin. These include rough skin cleansers, wart removal products, soaps or cosmetics that cause dryness, or products that contain alcohol, astringents, spices, or lime. That's enough for this video. If you want to watch more videos like this, please keep watching my channel. Disclaimer: channel's intention to make this video is for informational purposes only. Consult your doctor or healthcare provider for use of any medicine or for query of any disease. Thank you for watching the video. Please do not forget to like, share, and subscribe to my channel Medicine Guide. Up next, what are the side effects of tri-luma cream?